Well, today I want to talk about the second largest cause of human death and misery in the United States, cardiovascular disease. Number one, of course, is physicians. Each year, medical doctors, according to the Center for Disease Control, the Journal of the American Medical Association, and the Institute of Medicine, each year, medical doctors in America kill, injure, and infect 15 million patients in their workplace, hospitals and clinics and private offices. They don't even get an OSHA ticket. Well, number two is cardiovascular disease. Doctors want you to believe that cardiovascular disease is a genetic problem. It's not. It's not a genetic problem whatsoever. And cardiovascular disease is very, very simple. It's a combination, 99% nutritional deficiencies and 1% free radical damage. Cardiovascular disease can be divided up into congestive heart failure, the most common cause of heart death in adults in certainly the industrialized nation, is caused by a deficiency of a single vitamin. We've known that since 1742 when a Japanese naval surgeon figured that out. Secondly, is cardiomyopathy. Heart disease causes sudden heart death in athletes and people who do hard physical work. It's a deficiency of a single mineral. I've personally done 1,700 autopsies on people who've died of cardiomyopathy heart disease and consider an expert. Very simple disease to prevent. If you survive the first heart attack, you should be able to rebuild your heart and never have another heart attack by supplementing with the 90 essential nutrients. Coronary artery disease, and this is caused by lack of antioxidants and too many free radicals. Fried foods, processed meats with nitrates and nitrites, oils, including olive oil, coconut oil, margarine, mayonnaise, salad dressing, cooking oils, all cause inflammation inside the artery. I wrote the first paper on that in 1971 and was laughed at. And then, of course, there's thrombosis, coronary thrombosis, thrombotic stroke, pulmonary embolism, deep vein thrombosis. All this is caused by a deficiency of omega-3 essential fatty acids, or a ratio problem between omega-3, 6s, and 9s. I actually sued the FDA in federal court and prevailed to be able to say those things because they want you to believe it was cholesterol. It's not cholesterol. Coronary thrombosis, thrombotic stroke, pulmonary embolism, and deep vein thrombosis, and all heart disease, none of it is due to cholesterol. Okay? Aneurysms, spider veins, varicose veins, and hemorrhoids, which are just varicose veins in a funny place, all those things are actually caused by a deficiency of a single mineral. Okay, a single mineral deficiency causes aneurysms, spider veins, varicose veins, and hemorrhoids. What I want you to do, if you have any interest in preventing cardiovascular disease, you stay away from all the bad stuff. No fried foods, no processed meats, no oils, no gluten. Absolutely. You want to take the 90 essential nutrients, and I like the Healthy Brain and Heart Pack, 1 per 100 pounds of body weight. Take the Ultimate Daily Tablets to support healthy blood pressure and support healthy blood flow through even obstructed arteries. And then, of course, you want to take the de-stress capsules to deal with the congestive heart failure and many other different problems, including certain anemias. And that will prevent an enormous amount of these diseases because none of them are genetic. Okay, cannot stress that enough. None of them are caused by cholesterol. None. Taking cholesterol-lowering drugs will actually cause many diseases: Alzheimer's disease, low T, erectile dysfunction, menopausal symptoms, adrenal exhaustion. And so you do not want to take statin drugs. Statin drugs should be banned. They've actually, I would say, at a reasonable estimate, they've killed 1 billion people in the industrialized world. The Nazis only killed 40 million. And they're a very hated group of people. Rightfully so. Well, here's one class of people, medical doctors and their pharmaceutical buddies, through statin drugs and cholesterol-restricted diets, have killed over 1 billion people. And so I want you to get a hold of my book, Epigenetics. It is the final word. It just came out a couple of months ago. It's the final word on cardiovascular disease of all kinds. Tells you the exact cause of each one. Shows you very clearly that none of them are genetic. Epigenetics, the death of the genetic theory of disease transmission. Epigenetics, the death of the genetic theory of disease transmission. I urge you to get that book, and you'll be amazed. You also want to get a hold of the book, Rare Earths Forbidden Cures, and you'll see all these minerals that are missing and the vitamins that are missing that cause these diseases. Lack of antioxidants causes an increased rate of things like coronary thrombosis and coronary artery disease, simply because inflammation is the biggest cause, not cholesterol. Cholesterol was actually a conspiracy between Procter & Gamble and the American Heart Association in 1911, when Procter & Gamble paid American Heart Association $1.7 million to endorse Crisco as a much healthier way to eat instead of butter and cream. Oh, yeah, there was never any evidence. There was never any research to show that butter and cream are bad. It was all a sales agenda through Procter & Gamble, which gave the American Heart Association in 1911 $1.7 million to endorse Crisco as a healthier way to eat rather than butter and cream and lard. It was all a sales campaign to sell Crisco. No facts whatsoever. And, of course, it cost the lives of over 1 billion people. And somebody should go to jail here. Okay? I urge you to get a hold of the book Epigenetics. You'll read the story. It will blow your mind. Epigenetics, the death of the genetic theory of disease transmission, is one of those things that very clearly, and of course there's thousands of failed medical theories going back thousands of years ago. The medical system comes up with a new theory kind of like a week, and almost all of them, including the genetic theory and the cholesterol theory, the salt theory causing high blood pressure, those three right there went away in your lifetime in the late 20th century and the first part of the 21st century. Get a hold of the book, Epigenetics, the death of the genetic theory of disease transmission, and so you see how you can prevent and reverse cardiovascular disease yourself. Get a hold of the 90 for Life program. You'll be amazed. We'll be back with Dead Doctors Don't Lie for these messages. Okay, Doug, what pearls of wisdom do you have for us today?
I thought we'd talk about lung cancers. I've got a study here where the Fox News story, the headline reads, Insurance, Income, and Education Tied to the Survival After Lung Cancer Surgery. They said how long patients survive after they remove lung cancer may depend on factors like insurance, income, and education, according to a new study that was done by Dr. Felix G. Fernandez of the Emory Clinic in Atlanta. He's quoted as saying, we can start improving access for certain patients. They say the stage of the cancer is the most influential factor on outcomes, but they say understanding that all the factors tied to survival can identify groups of people who need more attention for quality improvement. They use the National Cancer Database and identified 235,000 plus patients who were diagnosed with non-small cell cancer between 2003 and 2006, and close to 93,000 of them underwent surgery to remove the cancer. Patients who had the surgery had higher odds of survival. They said about 60% of the patients diagnosed with stage 1 cancer survived at least 5 years, and compared to 40%, 31%, and 20% for stages 2, 3, and 4, respectively. Say patients with higher stage and larger tumors, positive lymph nodes, and older ages at diagnosis are more likely to die during follow-up years. They said accounting for those factors, a lack of insurance, lower income, and lower education level were associated with a worse overall survival after surgery. This all published in the Journal of the American College of Surgeons. It said patients with the lowest education and lowest income level had about a 10% increased death risk, and not being insured up that to 23%. And according to this Fernandez guy, he said it's hard to determine how the socioeconomic factors work together. And he says it's not well understood why these factors influence outcomes after surgery. Say the likely influence of the type of cancer, the type of center at which patients were treated may have an effect on the accuracy of staging and the type of treatment recommended. They said people treated at community health centers were more likely to die from after treatment than those treated at academic or research institutions. They say patients at recognized centers undergo more appropriate operations that are likely performed by more specialized and better trained surgeons. They said in addition, a quality of follow-up care or lack thereof after the surgery also had an important impact on the outcomes, and not one mention of preventing cancer by doing a high auric intake on a daily basis.
Yeah, very, very insightful on your part, Doug, exactly. We can actually reduce the risk of breast cancer by 462% just by having women eat their meat cooked medium rare instead of well done. We can reduce the risk of breast cancer by 82% by supplementing with selenium. Dr. Gerhard Schrauser showed that. And then it's very clear we can reduce risk of breast cancer by an initial 32% with a supplementation of the 90 essential nutrients. This was a study done by Clemson University for us in human cell cultures with breast cancer. We can reduce the risk of colon cancer by 95% in human cell cultures that have been afflicted with colon cancer by 95% by giving them the 90 essential nutrients, the 90 for Life program. And so there's many, many things we can do. And, of course, changing diet, getting rid of all the free radicals, getting rid of the things that drive cancer, like oils, processed meats with nitrates and nitrites, fried foods and gluten, no wheat, barley, rye, and oats. And then you throw in the 90 for life, get up to 100,000 ORIC points, as you say, per day. And they're going to have a greater rate of survival. The quality of life will certainly be better. And I urge people to think in these terms. Another round of chemotherapy, not going to work. And, of course, chemotherapy kills normal cells as well as cancer cells. Thank you so much, Doug. Good job as usual. We'll be back with Dead Doctors Don't Lie for these messages. Okay, Doug, let's go to callers.
Let's head to Santa Cruz, California. And Kat, you're on with Dr. Wallach.
So, Kat, you're on the air.
Hey, Dr. Wallach.
Hi.
I went to a neurologist recently. I'm on some of the Healthy Start Pack products now. But he diagnosed me with a brain scan that showed a large amount of subcortical and deep white matter, T2 hyperintensities of the frontal lobes. So I'm wondering what that means, and if I need...
wait a minute. What did he tell you what it meant?
Well, he said memory loss, he suspected, but it could be due to depression.
Okay,
So
now I want to know wait a minute. Depression doesn't cause white matter on the surface of the brain.
Right.
So is he saying that that's calcium? What is it?
He's not saying. He says he believes it's a memory loss. And then I just read to you what it said on the record.
Yeah. You need to have another neurologist look at that data, look at the brain scan, and because this guy's not telling you anything. Oh, there's white matter on there. I believe it's caused by memory loss. It's nonsense. Absolute nonsense. Okay. Do you have a memory problem?
Oh, yes, I do have a bit of a memory problem.
Okay. How much do you weigh?
120.
And how tall are you?
5'8".
Okay, so you're very slim. And do you have any skin problems, any eczema, dermatitis, or psoriasis?
No, but I'm gluten-free.
Okay. Is everybody in the house gluten-free?
Yes, including the pets.
Okay, good. And then it'll work. Okay, then what I want you to do at 120 pounds is get one healthy brain and heart pack per month, get an extra bottle of selenium so you can take 3 selenium twice a day, get 2 bottles of the D-stress capsules, capital D like David, dash stress, which you take 3 of those twice a day. That's for particular for brain metabolism, has to do with memory and so forth as well. And then I want you to get the Smart FX. Smart FX, I want you to take 9 of those a day, 3 at breakfast, 3 at lunch, 3 at dinner. These are little small soft gel capsules. They're about the size of a pea, and it'll be 3 bottles a month, and they contain DHA and EPAs, which are the raw materials for your neurons, your brain cells, to make neurotransmitters for memory and cognition problem solving. So I want you to take 9 of those a day. Then I want you to take the Immortalium. Immortalium actually has the material in there to help telomeres maintain longer life, increase the stem cell activity, regrow stuff. And so once you take 3 of those twice a day, it'll be 2 bottles a month of Immortalium. Stay away from fried foods, processed meats, oils, and gluten. Call me every 2 weeks. Let me know how the memory's doing, Kat. Let me know anything your doctor says in future visits. But I go to another doctor and get another opinion. We'll be back after these messages.
Let's head to Los Angeles, California. And Mary, you're on with Dr. Wallach.
Well, Mary, you're on the air.
Okay, thank you. My son is on a medication called clozapine. And,
okay, what's his problem?
He was saying that people were following him, people are filming him.
Okay, so he's paranoid.
Yeah, paranoid, and he was hospitalized for a month. And he's been on this medication for a month now. For 7 months. He has to.
Okay, now wait a minute. Is he a student or is he working or not working?
Yeah. Right now, he's after the medication. He's okay. Goes to school. He works. He's 20 years old.
Okay, and what kind of work does he do?
Oh, it's just temporary. Just while he's going to work, he's just working in a fast food.
Okay, and what is he studying?
He wants to be a computer science.
Okay, now does he have any history of any skin problems, any eczema, dermatitis, or psoriasis?
No, not as far as I know.
Does he have any? Well, you'd know your mama, right? Does he have any? Does he have any history of problems such as asthma, bronchitis, respiratory stuff?
No.
Does he have any history of any bowel problems, constipation, diverticulitis, his appendix out, anything like that?
No.
Okay. Do you have any other children?
Yes, I do, and he's the last one.
Okay. Do any of them have any health problems?
No.
None. 0 health problems?
No.
I don't believe that, but you need to ask him probably, okay?
Okay.
It would help us to ask. Okay, what does this young fellow weigh?
He's about 5'9". He's about maybe 155.
Okay. Does he live with you?
He lives with me?
Does he live with you?
Yes. Okay. I'm the one who gives him the medication every night.
Okay, and so you know he's getting his medication, and you know what he's eating at least for dinner and breakfast.
Yes, and of course the medication make craving like sweets, and now his stomach. He's a very athletic kid. Ever since he was like 2 years old, and his stomach is bloating. Like you can see his belly's getting bigger, and of course the medication makes him to eat more. But he works out. He tries to work out, and he wants to get out of the medication.
Okay. So, Shar, you there?
Yeah.
Okay, kiddo. What would you do for this fella? He has emotional problems, okay?
Bloating stomach, that sounds to me like a, gluten, irritable bowel type thing.
Okay.
Doesn't it to you?
Yep. And, of course, when somebody has emotional problems, paranoia, depression, manic depression, bipolar disease, these things are always caused by, if you ask the psychiatrist or psychologist, they'll always say a chemical imbalance. But really, it's a nutritional deficiency.
Right.
And so what would you do for a 155-pound guy? Obviously, he needs to get off of gluten, fried foods, processed meats, oils, and sugar. But what would you do for him as far as a supplement program?
I would get him on 2 brain and heart packs and also add the de-stress to that.
Okay, perfect. 3 de-stress twice a day. That's 2 bottles a month. 2 of the healthy brain and heart packs. And then call us every 2 weeks, Mary. We'll walk you guys through this. We'll be back after these messages.
Let's head to San Mateo, California. And Emir, you're on with Dr. Wallach.
Emir, you're on the air.
Yes, Dr. Wallach. I talked to you before. Today I'm going to talk about my nephew and his pet, the Chihuahua, and I love the name I gave her, Shalaga. She's suffering from constipation. She has difficulty doing number 2.
Okay, do you know how old this dog? Wait a minute. Do you know how old this dog is?
It's 7 months.
7 months, okay. And do you know if it's being fed dry dog food or canned dog food?
I think the first one.
Dry dog food, okay.
Yes.
Do you know if the dog scratches and itches?
Yeah, sometimes, yes. I notice she does that, yes.
Okay. A Chihuahua is going to weigh about, what, 4 pounds, 5 pounds?
She's 8.5 pounds.
8.5 pounds, okay. 7 months old, it's a big dog, okay. 8.5 pounds, okay. Okay, Shar. What do you think this little Chihuahua's problem is? Itching, constipated?
It's got a gluten intolerance. Ta-da.
Yep, yeah, exactly. And, of course, you have a little dog about that size, right? Little bear?
Bear's 5 pounds, yep.
5 pounds, okay, so 8.5 pounds. What would you give this dog in addition to you got to change the dog food, got to go to a gluten-free dog food,
yep.
And what would you give this dog as a supplement?
I would give him the Arthrodex, but I would also I squeeze EFA from both of my dogs and put it in their food in the morning because they got dry skin otherwise.
Mm-hmm. Okay, exactly right. I'd go ahead and give this dog, Amir, 1 EFA Plus capsule and 1 EFA capsule. Puncture the capsules and squeeze it onto the food. Make sure it's a gluten-free food. And usually the constipation will go away in a couple of days by getting on a gluten-free food. In the meantime, again, the Arthrodex. It's I'd go with a half a scoop in the food every day. Okay, give us a call every couple of weeks on this one. All right, Doug, let's go to callers.
Let's head to Florida. And Sandra, you're on with Dr. Wallach.
Hello, Sandra, you're on the air.
Yes, doctor. I'm having a difficult problem with my pressure. He go high. And my sugar.
Okay, your blood pressure goes high and your sugar goes high?
Yes, very high.
Okay. Now, am I hearing music back there, Doug?
No.
No.
Okay, because I thought I heard music. Okay. All right, so what we're going to do here, how much do you weigh, Sandra?
140.
140, okay. Do you have any skin problems, any eczema, dermatitis, or psoriasis?
No.
Do you have any history of bowel problems, constipation, diarrhea, appendicitis?
Yes, sometimes the bathroom. I can't use the bathroom, and sometimes, some blood to come out or sometimes.
Okay, it's one time is constipation, next time is diarrhea. Back and forth. Mm-hmm. Okay. And do you have any history of asthma, bronchitis?
No.
No respiratory problems?
Well,
children?
When I was in the hospital, sometimes I respiratory problem.
Mm-hmm. Do you have children?
Yes.
Do any of them have asthma or bronchitis or skin problems?
Yes.
Okay. Okay, Shar?
Yep.
What's this lady's problem?
It's a gluten intolerance for sure. No question about it.
Okay, gluten intolerance. Now, she weighs 140 pounds. She has high blood pressure, and she's got diabetes. So what are we going to give her here?
Well, I'd give her a healthy blood sugar pack, but I would also add the Ultimate Daily in case the high blood pressure is caused by blocked up arteries.
Good. Okay, well, I'd give her exactly right, one healthy blood sugar pack per month, but I'd also get another bottle of sweeties, so she could have 3 sweeties at breakfast and 3 at dinner time. Well, 1 tablespoon or a half ounce of the OsteoFX Plus at breakfast and dinner, 1 scoop of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, and 3 of the EFA Pluses at breakfast, and the 3, I guess 3 of the EFA Plus would be 1 with each meal in this case, 1 with each meal. And then for the high blood pressure, as you say, Shar, I'd give her 1 of the the Ultimate Daily tablets, 1 bottle per month. It would be 3 Ultimate Daily tablets at breakfast and dinner. And they're going to support healthy blood pressure and healthy blood flow through obstructed arteries. And because she's going to be taking 3 of the sweeties twice a day, Sandra, you need to make sure you're going to take your fasting blood sugar every morning before you medicate yourself. And as your blood sugar drops, do as your doctor has showed you. You reduce your medication. If your blood sugar goes up, you need to take more. If your blood pressure goes down, you need to reduce your medication. And you get your blood sugar below 100 for every night or every morning for 7 days in a row without medication. You don't need to be on the medication, but I would check yourself once or twice a week so you're keeping track of your blood sugar. Keep a little logbook so you pay attention to that. But you must stay on the healthy blood sugar pack forever, because next week, next month, a year from now, 10 years from now, 100 years from now, the minerals will still not be in the soil, and your blood pressure problems and your blood sugar problems will certainly come back along with other things. So that's where I would start. Okay, Doug, we got time to start another one?
Yeah, let's head to New York. And Michelle, you're on with Dr. Wallach.
Hello, Michelle, you're on the air.
Hi, Doctor. Thanks for taking my call.
Yes, ma'am.
In 2000, I was diagnosed with sarcoidosis.
Okay.
I was on prednisone for about a year. I'm not on any medication right now, but I have a lung fungus, and it bleeds on and off. And when it bleeds, I'm given antibiotics. That doesn't seem to work. So I was wondering, what can I take to remove
Yeah, well,
the
antibiotics tend not to work on fungus at all. Okay. And let's see here. And your sarcoidosis, is it mainly in the lungs? Do you have skin problems, any tender ligament or joint problems?
One time I had like a slight lesion on my nose, but that's gone away.
Mm-hmm.
But that's the only problem I have. But right now it's the fungus in my lungs, and it bleeds on and off.
Mm-hmm.
So
I got you. How much do you weigh, Michelle?
I weigh about 185, 190.
Okay. And do you have any other issues, any diabetes or arthritis or anything?
Well, my AC1, I think that's what it's called. The last time I had my blood work, it was high, even though my doctor said it was fine. But I know it was like 8. So that's
yeah, you need to be below 5. So 8's 50% too high. Okay, hang on here. Char, where would we start with this lady? Yeah, sarcoidosis is kind of related to lupus and fibromyalgia and that kind of stuff.
I just get her. First of all, she should get on a gluten-free diet anyway, no matter what. But she needs 2 healthy start packs.
Okay.
And I would give her the killer biotic for that fungus.
Mm-hmm. Okay. All right. Very good. So, as Char said, let's get on 2 healthy start packs per month, 1 for each 100 pounds of body weight. 2 healthy start packs, but also just for your immune system. And I'd get you on 3 selenium twice a day. It'll be 2 bottles per month. And I would throw in the killer biotic, as Char says, get you 9 of those a day, 3 at breakfast, 3 at lunch, 3 at dinner. It'll be 3 bottles a month. And I would gargle with our colloidal silver. Say, put a dropper full in a couple ounces of water, gargle with that 3 times a day. And make sure you're staying away from the bad stuff that depress your immune system. No fried foods, no processed meats with nitrates, nitrites, no oils, and no gluten. Call us every couple of weeks. Call us every time you see the doctor, and we'll help you with that. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. We do have lines open. Give us a call. Okay, Doug, let's go to callers.
Let's head to Denver, Colorado, and Gail, you're on with Dr. Wallach.
Gail, you're on the air.
Thank you, Dr. Wallach. I'm calling for my son, who's 36 years old and has hyperhidrosis really badly. Mm-hmm. He has used hormones and has been continuing to use hormones. I did give him your minerals to try to just slowly get him on some good minerals with all the perspiration that he has. I purchased a healthy pack for him. He's a little worried to start it because if there's niacin in that pack, that can overheat him. He has a slow thyroid. His body temp is low, but that skin is hot, and it's really isolating him.
Okay. Now, does he have any skin problems such as eczema, dermatitis, psoriasis, or rosacea?
No, he doesn't. Not on the skin. But he has had asthma. As a little kid, he had a lot of allergies and that sort of thing.
Okay, today, does he have any, like, bowel problems, any constipation, irritable bowel syndrome, colitis, anything like that?
Well, he currently does take fiber to go to the bathroom, but as far as I know, he does go, and he's regular and all that. But
he has to take fiber to do that.
That's what I understand. Yes.
Okay. All right. Okay, Shar, what do we got here?
Another gluten problem.
Yep, another gluten problem, and of course, when you have sweating problems, if you were a child with asthma and hyperhidrosis, they say he had cystic fibrosis. Okay. Which is certainly not a genetic thing, and it's actually caused by a deficiency of the omega-3 essential fatty acids. Okay, and because he's malabsorbing them, right? And what does your son weigh?
He weighs right now 220 pounds. He's 5'10".
Okay, Char, what would you give him?
I would give him 2 healthy start packs.
Okay, very good. 2 healthy start packs. I'd go ahead and that'll allow him to have 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner. Let's see here. I would also, because he has a history of constipation, throw in the herbal rainforest. I'd go ahead and give him start out with a tablespoon, which is a half ounce of the herbal rainforest at bedtime, with a glass of water, and this is going to help him with the constipation. He'll be able to get off the fiber. I'm always concerned when people say I'm taking fiber, I hope it's not wheat bran. You know, it has to be something like rice bran or one of those kind of things. It cannot be wheat, barley, rye, or oats. It can't be any of that kind of fiber because it has gluten. And Shar hit the nail right on the head there. He's got a severe gluten problem as the basic underlying problem. And it wouldn't hurt for him to take the Immortalium. I'd have him take 3 of those twice a day. That'll be 2 bottles a month, and again, that's for stem cells to help his skin. But basically, he's got multiples of deficiencies caused by malabsorption, caused by gluten intolerance, resulting in a history of asthma, constipation, and malabsorption is contributing to his problems here. So it's going to be imperative that he, the dog, the cat, the bird, the fish, spouse, mother-in-law, anybody living in the house with him has got to be gluten-free also. There cannot be any gluten in the house because of cross-contamination probabilities in the laundry, the food preparation surfaces, the couch where everybody watches TV, etc. Okay? So give us a call every couple of weeks, please, Gail. Let us know how your son is doing with all these things. There's a very small amount of niacin. I don't even think it's a full daily requirement. I think it's like 50% or something like that in there. And so basically, that's going to be the least of his worries. Of course, our niacin is a non-flush niacin anyway, so it's not going to heat him up. All right? And so do call us every 2 weeks. Let us know how he's doing. Okay, how much time we have here, Doug?
About 10 seconds.
10 seconds. Well, I'm going to go ahead and take it. Remind everybody, my new book, Epigenetics. If you want to add 25 to 50 healthy years of your life, get my new book, Epigenetics, The Death of the Genetic Theory of Disease Transmission. You might want to throw in, if you don't already have it, Rare Earths Forbidden Cures and the book, Immortality. And you'll learn how to add 25 to 50 healthier years of your life. It's not all that difficult, but you do have to be obsessive about it. You have to do all the right things. Again, Epigenetics, The Death of the Genetic Theory of Disease Transmission. then go ahead and always look for us. Call us tomorrow. We'll be with you tomorrow. Thank you so much, Shar. Super job as usual. Thank you, Doug. And Billy, superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.